we are talking about the race to vaccinate the U.S. against the coronavirus, and that race is getting a much-needed boost. President Biden is pledging to secure 200 million more vaccine doses as the new administration steps up efforts to fight this pandemic. That's after state governors complained about running dangerously low on supplies and demanded more answers from the federal government. Well, according to the CDC, about 53% of the total vaccine doses distributed nationwide have actually been administered so far. People expected to receive shots in the coming weeks include all in-person staff at the White House. So Debra Alfarone is following the very latest from Capitol Hill for us. So Debra, how is the Biden administration planning for this increase? Because it's not just about getting the doses. There has to be people out there to administer the doses, places for people to go to. What's the plan?
Oh my gosh, we would have to have all day to talk about this plan because there's so many moving parts. But the one thing I do want to point out is that these manufacturers of the vaccines, they're actually getting a better idea of how much that they can produce because they've been doing this for a little while more. So they actually have more vaccines and they're producing more of them. That's the first part of this.
President Biden is increasing the available supply of coronavirus vaccines by 16%.
Weekly vaccination distributions to states, tribes, and territories from 8.6 million doses to a minimum of 10 million doses.
The White House will also be giving states a 3-week forecast of how much vaccine to expect.
This is going to help make sure governors, mayors, and local leaders have greater certainty around supply so they can carry out their plans to vaccinate as many people as possible.
Many governors have complained that the lack of information has slowed vaccination efforts.
Our providers have been bedeviled with uncertainty and unpredictability of the delivery schedules.
Some vaccination sites, like Louisiana's Oxnard Health, canceled appointments because supplies ran short.
When we realized that the supply was going to continue to be an issue, we said, that's it. No more new ones.
Colorado health officials say the extra doses will make an immediate difference.
This is some great news. We anticipate that we will be able to vaccinate more of that 70-plus population.
New cases and hospitalizations here in the U.S. are trending downward, but variants are threatening that progress.
Just another reason to recognize that we need to get this vaccine rolled out as quickly as we can.
Vice President Kamala Harris received her second shot yesterday. President Biden hopes to have enough vaccines for 300 million Americans by the fall.
And the administration is also going to be leaning on FEMA as far as getting those vaccination centers out there to answer one of your first questions there, Anne-Marie. Another thing that's interesting is they're going to have briefings 3 times a week, and they're going to have scientists and public health experts be speaking at them.
Wow, what a welcome change. Many of our questions will be answered. So listen, Debra, we have been told all along that the most vulnerable and frontline workers, they were at the front of the line for this vaccine. Makes total sense. But I think a lot of people are wondering, what about everyone else? Do we know when other Americans could get their first shot?
Well, a reporter asked President Biden, when do you think the average person could go get a shot? And he said the spring. Now, that is something that we've heard that, as time goes on, okay, the spring sounds good, but he also did say, he hedged his bets by saying, this is a logistical challenge that this country has never seen before. So he's sticking to that, though. He did say the spring, and we're going to certainly hold him to that, Anne-Marie.
Yeah, definitely. Spring could sort of conceivably be just a couple of months away. So we'll see. We're watching. Debra, thank you very much.
You're welcome.